In this video, we will discuss your biliary catheter. We will review care and maintenance, flushing the catheter, and common problems you may experience. At the end of this video, we will review frequently asked questions. The biliary catheter, also called a tube or drain, does the work of your liver by draining bile from your liver and gallbladder. The catheter can drain bile internally into your intestines or externally into a bag outside of your body. There are two different types of biliary catheters. Let us discuss each type. An external catheter is a catheter placed from outside the body into a bile duct of the liver. The bile will drain into a bag attached to the catheter. This bag needs to be positioned lower than the catheter insertion site. An internal external catheter is a catheter placed from outside the body through the bile ducts to the small bowel. The catheter will be attached to a bag that must be positioned above the catheter insertion site at chest level to avoid clogging the tube with contents of the small bowel. You may have two tubes if you need one for each side of the liver. If you have an external biliary catheter, there is a valve or stopcock on the tubing that allows bile to flow into the drainage bag. The valve is also used when flushing the tube. There is also a cap at the bottom of the drainage bag, which is used to empty the bag. We will demonstrate both in more detail later in the video. Daily care and maintenance is required to keep your biliary tube working and to prevent issues. You should empty the drainage bag when it is half full. For an external biliary tube, the bag should hang below your waist. For an internal-external biliary tube, the bag should hang above the insertion site, typically around your neck. This helps to promote internal drainage. Your doctors may instruct you to flush the tube every day. Every 3 days, you will need to clean the insertion site and change the dressing. Let's discuss how to remove the dressing, clean the site, and place a new dressing over the insertion site. You will need to change your dressing every 3 days, and you may need a caregiver to help you. You will need cotton swabs and/or gauze pads, soap and water, and surgical tape. First, wash your hands well with soap and water. Then remove the gauze dressing and throw it away. Always check the area around the tube insertion site for swelling, redness, and/or drainage around the tube. A small amount of redness and/or drainage is normal. Carefully remove any drainage or dried fluids using a clean cotton swab or gauze pad with soap and water to get close to the tube insertion site. Use a circular motion to clean around the tube and outward about 3 inches. Dry your skin well with a clean towel or gauze. It is important to keep the area around the tube insertion site clean and dry to prevent skin irritations and infections. Do not use creams or ointments around the tube insertion site unless directed to do so by your doctor. You should not submerge in any water while you have a biliary tube in place. This includes tubs, hot tubs, pools, oceans, ponds, and rivers. Apply a clean, new gauze dressing and tape it down around the insertion site. It is important to keep the biliary tube covered with a gauze dressing. You can shower with the dressing on, but you must first cover it with press and seal or saran wrap. These can be purchased at a local store. You can also purchase AquaGuard through a medical supply company or online store. If the dressing becomes wet, remove it and apply a new one. If instructed by your doctor, you may need to flush the tube every day to prevent clogging. You will need a pre-filled saline 10 milliliter syringe and 2 alcohol wipes to flush the tube. You will start by taking the syringe out of the packaging, remove the cap from the stopcock side port, and clean it with an alcohol wipe. Remove the cap from the syringe and attach the saline syringe to the side port of the 3-way stopcock by pushing the syringe in and turning clockwise. Make sure the stopcock on-off flow control is in the off position and pointing towards the bag. This ensures that the flush flows in the correct direction towards your body. Gently push the plunger of the syringe to instill the normal saline, usually 5 or 10 milliliters. Return the on-off flow control to the open position on the valve to allow drainage into the bag. Remove the syringe by turning it counterclockwise and pull it away from the stopcock. Clean the stopcock side port and reconnect the cap. You will need to empty the drainage bag when it is half full to avoid it pulling on the biliary tube. To empty the bag, you will unscrew the cap at the bottom of the bag. Allow the bile to drain into the toilet or container, then screw the cap tightly to close. For 24 hours after your biliary tube placement, you should not drive, take sedatives, drink alcohol, or take NSAIDs, such as aspirin, ibuprofen, or naproxen. If you take blood thinners, you will be told when to restart them. You may have soreness at the tube site for the first 1 to 2 weeks. Avoid doing any activities that cause pulling of the tube. It is important how to troubleshoot common issues that arise. Leaking or drainage around the tube is common, especially right after the tube has been placed. If you are experiencing leaking and drainage around the tube, there are a few things you can check. First, check with the stopcock. Make sure that it is in the correct position and allowing bile to drain into the bag. Next, you can check under the dressing for kinks or bends in the tubing that may prevent drainage. Finally, if instructed by your doctor, flush the tubing. If you are unable to flush the tubing, do not force the plunger. The tube will likely need to be changed. If you cannot flush the tube, call the interventional radiology department to schedule an appointment. Reasons to call your doctor include: you have chills or fevers of 101.5 or greater, you have severe pain or redness around the tube insertion site, you have abdominal pain, back pain, or side pain, you notice there is not as much bile or none at all in the bag, you have foul-smelling yellow or green drainage, pus, or any drainage that concerns you. Your drainage tube is leaking, breaks, or falls out. Call immediately for an exchange. If you have any other questions or concerns about your biliary tube, you can call interventional radiology at 813-745-2246, Monday through Friday, 8 a.m. to 5 p.m., with the exception of weekends and holidays. If it is after hours, a weekend or holiday, you can call the patient care hotline at 813-745-8000 and ask for the interventional radiologists on call. Some frequently asked questions. Can I swim with my biliary tube? Do not submerge in any water while you have a biliary tube. This includes baths, hot tubs, pools, the ocean, ponds, and rivers. How long will I need my biliary tube? That depends on you, your treatment plan, and your doctor's recommendations. Does the tube ever get changed? The tube will be exchanged every 3 months for as long as you have the tube.